So today I am going to discuss a scenario of rheumatology with you people, and you have to diagnose the scenario. And in the last part of this video I will share the answer and the different aspects of the disease. So let's start with this scenario. We have a 40-year-old woman presented with the bilateral hand and the knee joint pain that has slowly been getting worse over the last 6 weeks. Her hands feel tight in the morning, means there is morning stiffness, and she has to wait for 45 minutes to an hour for them to warm up. It means that the pain is after working or after doing some activity, the pain goes away. Then his medical history is significant for vitiligo for last 4 years, and that vitiligo is limited to her face and upper thorax. She also suffers from pericarditis, and that has been resolved with the use of NSAIDs. Physical examination reveals the swelling of metacarpophalangeal joints and proximal interphalangeal joints. And the important point to note is that the DIPs, distal interphalangeal joints, are spared. So what would be the diagnosis? So I repeat the important facts in this scenario, that the disease is related to middle-aged women, that involves the bilateral hands and the knee joints. Then there is morning stiffness. It is associated with the autoimmune diseases. Then she also suffers from the metacarpophalangeal and PIP, proximal interphalangeal joint swelling, but the distal interphalangeal joints have been spared. So the only disease which spares the DIP and involves the PIP and the MCP, metacarpophalangeal joints, is the rheumatoid arthritis. You are right. You guessed the very right answer, that it is the rheumatoid arthritis. And let's discuss. It is an autoimmune disease, presents with the morning stiffness and improves with doing activity, involves more than 3 joints, and it lasts for 45 to an hour, and after that it resolves with the time as we do activity. So the what is the single most important test to diagnose the rheumatoid arthritis? Maybe you are going with the rheumatoid factor, but the CCP test, anti-CCP test, is most important, most diagnostic and specific for to diagnose the rheumatoid arthritis. So what is the best long-term therapy? So what we can give to the patient for this disease? We can give the NSAIDs, as it is an inflammation. So we can give the NSAIDs that will inhibit the COX-1, COX-2, and after inhibiting them they may decrease the inflammatory response of the body. We can also give the DMARDs, and we can use the anti-TNF, tumor necrosis factor drugs. For example, in this drug, the brand names, or you can say the chemical names included, are infliximab. I think that is the anti-TNF factor. Then we can also use the hydroxychloroquine. Okay? Or hydroxychloroquine and sulfasalazine, they both are safe in the pregnancy. So as this disease suffers, or this disease attacks the women mostly, so we have to consider that if either the woman is pregnant or not. So sulfasalazine, hydroxychloroquine, they are safe in the pregnancy. We can use them in the pregnancy also.